Step 75, two hurdles. In IVF, you have two big hurdles to clear. One is creation of high-grade embryos and successful implantation of one of those high-grade embryos in the uterus. If you're not expecting any problem with creation of high-grade embryos, if you do not have any uterine problems, then you can create the embryos and immediately transfer in fresh cycle to try and achieve success. If not successful, you can transfer in your next frozen cycle and try and achieve success. But if you're struggling to create high-grade embryos, you should not try and transfer those embryos in fresh cycle, because fresh cycles are optimized for creation of embryos, not for implantation. If it's so difficult to create high-grade embryos, you don't want to waste those embryos. You shouldn't transfer until you're really sure that uterus is optimal for implantation. Equally, if you have uterine problems, structural problems, or inflammation like severe endometriosis or adenomyosis, you should not try and transfer embryo in fresh cycle or immediately after fresh cycle until you sort out those problems. Here you need to clear these big hurdles one by one. First, you need to focus on optimization for creation of number of high-grade embryos and freeze those embryos. Second, you need to investigate for uterine factors, like by doing a deep ultrasound scan, MRI scan, hysteroscopy, and laparoscopy. Sort out those problems, then transfer the embryos when the conditions are optimal. Clearing these important hurdles one by one gives you most optimal chance of achieving successful pregnancy without having too many implantation failures.